Welcome to Thermodilution Cardiac Output, Principles and Procedures using the Cosette Plus Injectate System with the Hemosphere Monitor. Thermodilution cardiac output uses an indicator dilution method, in which a bolus of cold saline is injected rapidly via the blue proximal injectate port of the Swan-Ganz catheter into the right atrium. The injectate mixes with the blood, and the change in temperature over time is detected by the thermistor, positioned approximately 4 centimeters from the tip of the catheter. The size of the curve is inversely related to cardiac output. A small curve indicates a higher cardiac output, with the injectate rapidly passing the thermistor due to higher flow rates. A larger curve indicates a lower cardiac output, with the injectate taking longer to pass the thermistor due to lower flow rates. The area under this thermal curve represents the change in temperature over time and is converted to flow using the Stewart-Hamilton equation. It is displayed as cardiac output in liters per minute. The Stewart-Hamilton equation uses the patient's blood temperature, the injectate temperature, the injectate volume, a computation constant, and measured area under the thermodilution washout curve to calculate flow. Required equipment for the thermodilution procedure includes the following: a cardiac output monitor, such as a hemosphere monitor, a cardiac output cable to connect to Swan-Ganz thermistor and injectate temperature probe, an injectate temperature probe. Disposables include a Swan-Ganz thermodilution pulmonary artery catheter, a Cosette Plus closed injectate delivery system, sterile injectate solution, usually normal saline or D5W. The Cosette Plus closed injectate delivery system allows the clinician to perform intermittent bolus thermodilution cardiac output measurements when used in conjunction with a Swan-Ganz thermodilution catheter and a compatible cardiac output monitor. This closed injectate delivery system with a flow-through housing helps mitigate contamination from frequent access of the sterile system, warming of injectate due to handling, and allows for measuring the injectate temperature with each bolus. Room temperature cardiac output measurements have largely replaced ice thermodilution due to the ease of setup and maintenance compared with cold iced systems. The use of aseptic technique should be observed throughout the preparation and use of the Cosette Plus product. The Cosette syringe is specially designed with a plunger contamination sleeve to maintain sterility of the syringe plunger, a double-barrel syringe to mitigate heat loss of injectate solution with finger grips to maintain control of the syringe during injection, one-way valves to prevent blood being aspirated from proximal injectate lumen, and injectate solution from being pushed back into the IV bag. Inline injectate temperature probe to measure the temperature of each bolus. Cables specific to the hemosphere monitor include the patient CCO cable, model 70CC2, and the inline injectate temperature probe, model 93522. Connecting Cosette Plus injectate delivery system to Swan-Ganz catheter. If the right atrial pressure tubing is connected directly to the blue proximal injectate lumen, perform the following. While maintaining sterility of the connections, disconnect the pressure tubing from the blue lumen and insert the Cosette Plus system. Connect the Cosette Plus stopcock directly to the blue proximal injectate lumen. Then connect the right atrial pressure tubing to the Cosette Plus stopcock. Turn stopcock off to the Cosette Plus syringe and confirm presence of right arterial pressure waveform on the bedside monitor. Connecting Cosette Plus injectate delivery system with existing stopcock to Swan-Ganz catheter. If the right arterial pressure tubing is already connected to a stopcock directly attached to the blue proximal injectate lumen, perform the following. Remove the cap on the stopcock, discard the stopcock on the Cosette Plus system, and connect the Cosette Plus system where the cap was removed. Configuration of Hemosphere Intermittent Cardiac Output Screen. Configure your intermittent cardiac output by pressing the Clinical Tools tab and then press the iCO icon. Select a value from the Injectate Volume List button. The most common value is 10 milliliters. Select a catheter size from the catheter size list. Commonly used sizes are 7.5 and 8 French. The computation constant can be automatically calculated by entering the injectate volume and catheter French size. If manually entering, touch the Comp Constant Value button and enter a value obtained from the computation constant card available at edwards.com. Select Auto or Manual from the Injection Mode List button. The default mode is Auto. In the Auto mode, the Hemosphere Advanced Monitor automatically highlights an inject message upon receiving a baseline blood temperature. The manual mode operation is similar to the automatic mode, except that the user must touch the inject button prior to each injection. The following section provides instructions for both of these bolus modes. Auto calculation of the computation constant is preferred due to its ease of use. However, if needed, the computation constant can be determined by using the computation constant card available on edwards.com. First, identify the catheter model being used, located on the back form of the catheter. Determine the injectate volume. Most frequently, a 10 milliliter injectate volume is used. Determine the injectate temperature. Most frequently, room temperature is used. Identify the computation constant associated with that model number or French size, the injectate volume, and the injectate temperature. Enter the computation constant into the monitor. In some cardiac output monitors, the computation constant may remain from a previous procedure. Confirm that the value is correct for the catheter, volume, and injectate temperature being used. Bolus thermodilution procedure. Aspirate a full 10 milliliters in the Cosette syringe and wait for Inject to display on the monitor, or press Inject to initiate a bolus. When the monitor displays Inject, rapidly inject the full 10 milliliters of injectate solution in one smooth motion within approximately 4 seconds. Injections can occur at the end expiration of a positive pressure breath to mitigate effects of decreased venous return or throughout the respiratory cycle. Injection timing per institutional practice. Do not start and stop injections. This may result in erroneous readings. Injecting a volume which is less than what is entered into the monitor will result in an erroneously high cardiac output measurement. For example, 10 milliliters is programmed into the monitor, but 5 milliliters is injected. If measurements are closely grouped together, then a minimum of 3 boluses can be averaged. If measurements vary, then up to 6 boluses can be performed and outliers edited out. After the average of the series of boluses has been accepted, use the cardiac output values as part of your patient's hemodynamic profile. Thank you for watching Edwards Lifesciences Thermodilution Cardiac Output Principles and Procedures. Explore edwards.com for additional educational materials.